Nurses here at Montefiore New Rochelle say they are prepared to strike, and they did give the staff here a 10-day notice. They say as we are entering a second wave of COVID, they need more help, they need more staff, and if they do not get that, they are prepared to strike as early as December 1st.
We definitely need more staff. I mean, myself, we stay late every night. We skip our breaks regularly, and we still feel like, we're lucky we made it through the day without anything going terribly wrong.
As New York braces for a second wave of COVID-19, Montefiore New Rochelle is on notice. Nurses at the hospital say they will strike beginning December 1st if contract negotiations don't begin. Melissa Ricketts voted in favor of the strike.
My fear is that we're not going to be able to get any staffing, to be able to take care of the patients.
And she's not alone. Nurses in New Rochelle and the Bronx and members of the New York State Nurses Association took to the streets Thursday, pleading for more healthcare workers and medical supplies and better wages and benefits. They gathered outside Montefiore Moses in the Bronx and marched to Woodlawn Cemetery.
New Rochelle was ground zero for the COVID outbreak in New York State, and we didn't think twice about doing whatever it took to take care of our community.
Workers say they've been fighting for a fairer contract for 2 years, even before the pandemic. Adding staffing at the hospital is 1 nurse for every 9 patients on the medical and surgery floors and 1 for every 3 patients in ICU.
We're just trying to get a fair contract that allows us to do our job.
Hospital staff telling Pix 11, quote, "It's disgraceful that the New York State Nurses Association leadership is threatening a strike after being offered 7% in salary increases during a pandemic when hospitals and individuals are struggling financially," end quote. Still, nurses say it's not enough, and a strike is the last thing they want to do, especially now. But they have to, not only for them, but for the survival of their patients.
The nurses there have been through so much, and we are about to go through it again, except with even less staff than we had in March.
And nurses say they don't necessarily need a contract by December 1st to avoid a strike. They just want to start talking. They want the negotiations to begin. In New Rochelle, Jennifer Bisram, Pix 11 News.